Hello and welcome to this edition of Let's Talk About It. Our topic today is on breast cancer. I have here with me Lady Oliver. Welcome to the show, Lady Oliver.
Thank you.
And I also have Dr. Atkins. Dr. Atkins, thanks so much for showing up.
Thank you for having
We
me.
appreciate you.
Okay.
Yes. Now, we want to talk about breast cancer and breast cancer awareness. I'm going to talk to you first, Dr. Oliver. When it comes to breast cancer and the awareness and early detection, what is it that you recommend from a doctor's perspective for ladies to take care of?
Well, I think as ladies, we need to get more proactive about preventing breast cancer. Mammograms are the first line, and that's the gold standard. But I want women and men, because men can get breast cancer too, to know we need to be more proactive. So at our office, we have a breast cancer prevention program where we empower women to do things in addition to mammograms to protect their breasts.
Okay.
Nutrition, lifestyle, dietary things that we can do to prevent breast cancer. So that's an important thing. So and so we coach on that. In addition, we do thermography. We do a heat-censored imaging of the breast. It is a camera, but it's a heat-sensor camera. There's no radiation and no pressing. But it is a screening to find changes earlier. Many times when they're reversible, it can find suspicious changes months to years before a density or spot is seen on a mammogram.
Wow.
Because for the average mammogram, it takes up to 8 years for bad cells to multiply to form a spot or density. So we want to get more proactive where we can reverse changes early. So there are some women that have a mammogram each year and are still diagnosed. There's some women that are diagnosed before the age that they start with mammograms, because we know younger women have dense breasts, and so mammogram is less sensitive to pick up suspicious changes. And so it's not recommended till 40, 45 generally, unless you have a family history, because those dense breasts, they'll miss things. And so that's where thermography is a great adjunct to a mammogram, or something we could start earlier for younger women. Women that have dense breasts, which could be mature women, over 50, and younger women. Many times when you look at a mammogram report, the doctor will get a report that says dense fibrocystic breasts. And a lot of women don't realize they have dense fibrocystic breasts, but that decreases the sensitivity of mammogram, meaning increases the likelihood things will be missed. And so that's where thermography is a good adjunct. The great thing is no radiation. We're concerned about the cumulative effect of radiation, because radiation can cause cancer. Mammograms are low-dose radiation, but over our lifetime, women are living longer. So we want to minimize radiation. Even going to the dentist, you think about every time you get x-rays, you know,
Same thing.
that radiation can expose other areas like the thyroid. So I tell patients when they go to the dentist, get a thyroid shield to prevent additional radiation being exposed to other parts of the body. But anyway, the thermography is no radiation. So it can be, in addition to mammogram, you can do the thermography, or they can, for women that are younger, they haven't reached the age, they can do thermography. Women with implants that have had cosmetic implants, either after cancer or cosmetically, it's a good way to screen, because we know that the pressing with mammograms can increase the risk of rupture of the implants, because implants are like, you think of tires, and so when they have a lifetime on it. They have a lifetime on it. They're not indefinite, and so the more pressing and squeezing we have increases the risk for rupture. And so usually the average lifetime for implants may be 10, 11 years. We may need to change them out. And so, but some women are doing, with implants, are doing more screening with thermography as well. Women with family histories, starting younger, older. So it's available for everyone. We do the breast, but there's other parts of the body that we screen with the thermography. We're looking for vascular changes, or neovascularity, a big word for new blood vessels that grow, that can feed a worrisome tumor, and we're looking for inflammatory changes. And so fibrocystic breast is a sign that there's been an imbalance in the hormones, and we're in our office, we're looking for hormone imbalance early that can stimulate the breast. And so we want to change that. So we do a lot of screening for hormone imbalance, and more natural balancing of that for women and men.
Okay.
Also, we talk about different natural supplements like iodine. We find that iodine is a really important mineral, and when we are deficient of it, can cause more fibrocystic changes
Okay.
and increased risk for tumors of the breast, because the breast take up iodine, not just the thyroid, also the prostate and the ovaries. And so
Really?
we find that, holistic doctors are giving more therapeutic doses of iodine to help these areas. So there's so much more that is available that is not known, especially in the African American community.
Mhm.
Digital thermography is not well known. It's something that we do under $200 in our office. Insurance companies don't always pay up front for that, but I
Okay.
tell people it's investment in your health. I mean, we pay hundreds of dollars sometimes on our hair, handbags,
Right.
shoes, outfits, but when you talk about our health, sometimes we need to be more proactive.
That's the last thing sometimes that we tend to think about.
Yeah,
I want to go
exactly.
back to something that you said earlier about the breast cancer existing sometimes 8 years prior to it ever being evident on camera. I had no idea that it could actually exist for that amount of time before it can even be detected or noticed.
Right, those cells need to multiply before they're large enough to be seen on a mammogram,
Okay.
to be a spot on the mammogram, and so a density there. So you have to think, they've been multiplying for a while. It didn't happen overnight,
Uh-huh.
and so we, at our office, we're interested in changing the process what stimulated those cells to
grow.
grow. And so we want to change the environment of our body. So
Okay.
we talk about alkalizing our diet, eating more rabbit food and
Mhm.
green drinks.
Right.
Like I brought today, I brought a green drink. But
Okay.
but alkalizing, we talk about iodine, we talk about hormones, and we talk about decreasing the sugar and the starches that cause the cancer cells love to grow in a starchy, sugary environment in our body.
Really?
So we want to change that environment.
Wow. And you know what? I'm so glad that you're giving this type of information, because this is the type of information that I think women need to educate themselves and to make them more aware of this particular cancer that's taken over so many of our African American people, and women and men.
Exactly.
In general. Now, another one of my guests today is Miss Lady Olivia, who is actually a breast cancer survivor.
Yes, yes.
Yes. Now, how long ago has it been? I know I know it's pretty recent, but just for my...
Well, actually, I finished my last treatment in July, so I am a new cancer survivor.
Yeah. Now, tell me, what was that experience like for you?
Well, it wasn't as scary as most people, say it is for them, because it's an individual experience.
Mhm.
But much like she was speaking on, I have fibrocystic breasts,
Okay.
and I always have the fibers and the cysts coming up, and I always feel those and always know they're there. And I knew
Okay.
that there was one there. But unfortunately at the time I was dealing with my father who was actively dying, and I kind of put myself on the back burner and
Mhm.
didn't go get it checked out.
Okay.
And so one day my son came home from school in October of last year and said, "Mom, have you had a mammogram?" And I had to stop and say, "No, I actually haven't, and I need to, because I had missed the opportunity to do it."
Mm-hmm.
So I went in and I went to the Rose. They did my mammogram for me, and from that they saw something on the film and decided that I also needed a biopsy.
Okay.
So they did the biopsy, and it was indeed,
Cancerous.
it was, yeah.
Okay.
Mhm.
So tell me this, when you first discovered breast cancer,
Mhm.
the second thing that you do is get a biopsy? Is that correct?
Well, that was the way it worked for me. I
Okay.
mean, and I've spoken with a lot of breast cancer patients and survivors, and almost every situation is different. For
Okay.
me, I went through, let me say my tumor was 5.8 centimeters, which is about the size of an egg. And you want to know, how could you let it get that large? And it was very fast growing. It was originally something I felt as like a knot.
Yeah.
And then within a month or so, it just turned into something that wasn't any longer round, and it was changing shapes, and it was quick. It was a very
Wow.
fast
So it was very
growing.
aggressive.
It was very aggressive. Yeah, it was
Wow.
aggressive ductile carcinoma. invasive ductal carcinoma.
So did you go into a panic attack when you started to feel the difference in it growing so fast? Did you go into that mode?
No,
or?
I didn't go into a panic attack. I went into prayer.
right.
I went into prayer.
Mhm.
So, you know, that was part of my process. I've always had a relationship with God, but it's something like this that it brings you closer even still. And just like Dr. Atkins was speaking on, the nutrition side of things. I went through my treatment at MD Anderson, and they offer a nutritionalist for you to help you to make healthier choices. And so that was something that I changed. I stopped eating meat early on, so it's been maybe 6 or 7 months now since I've had anything other than fish.
Really?
Primarily vegetables and fruits. And I am now juicing as well. And she and I were talking about a good green recipe for juice prior to coming on camera.
Okay.
So, excuse me, I'm now more into the nutrition of things and making sure I cut as much sugar as I can and avoid the white foods, the flour, the starch, potatoes, rice. I mean, I try to avoid those as much as possible and focus on the vegetables and the fruits and the fish. And so, and then exercise. You have to get up and move. And I have to admit, I hadn't been doing that. I've just been living life, going out there, you know, making it happen on a daily basis. And, you know, you just put yourself last.
Right.
And so, you know, basically I ended up with a new passion in life, telling people about breast cancer, how you can avoid it in a sense by keeping your weight at a certain level, your BMI, keeping your nutrition the way it should be, get up and move, and of course, you know, your relationship with God.
That's all important. And you know, we're going to touch back on a little bit more of what you said when you're talking about the BMI and things of that nature, just so we can make sure that everybody's educated on what those things mean, because the whole purpose is to educate, motivate, and inspire with the show. We're going to be back in just a moment with more of Let's Talk About It. You guys want to stick around. Thanks so much. All right, welcome back to this edition of Let's Talk About It. I have a small name correction to make. I had said the wrong name before, and who I have here today is Lady Oliver, who is sitting to my far right, and next to me is Dr. Pamela Atkins. Welcome back to the show, ladies.
Thank you.
Thank you.
All right, now that we've cleared that up, we're going to get back to our topic at hand. Now, we're talking about a very serious subject, the subject of breast cancer awareness. You mentioned so many things that are bad for the body. So what are some of the good things that we can put into our bodies to help us in preventing cancer in the body, period?
Okay. I think that's an excellent question, and I think we want to be live and vibrant, so we need to eat live and vibrant food. So we really need to emphasize the amount of raw foods we eat, raw produce. And so we cook our foods and our produce, our vegetables, and we cook all the nutrients out of the enzymes out of them. And so we want the more live our food is, the more vibrant and healthier we'll be. So we need to eat more salads, uncooked vegetables. So I push our patients to do at least 50 to 75% raw, and listen to your body. Some people feel best being 100% raw, but the more we eat, look at our plate, we want 75% to be fresh veggies, whether it's cucumbers, tomatoes, salads, etc. And then the other portion can be could be beans, rice, fish, for those that eat chicken, organic chicken, etc. But I think the less meat is best, and I think we really need to look at our body, listen to our body. Our body will tell us. So that's why we need to do more juicing. I do more in the blender than juicing, because I think we eliminate the fiber. We really need that fiber that God gives us with the vegetables and fruits. So I do a lot of smoothie type things or green drinks with the fiber in it, where I put all the vegetables in with the water and make a green drink. So you just thin it out with water to make it pulpy. If you want to make a smoothie, then you could do it with the coconut milk, coconut water. We use, at our house, we use live coconuts that, my husband chops with the machete.
Really?
And the water, and you scoop out the gel. But, it's more live with the nutrients, but then you can put your fruit, and usually we do still make green things with it, but
Okay.
we need to be conscious of that, eating healthier and get away from the packaged food. We've become a processed society, so we have packaged bread, crackers, cookies.
Everything
and-
quick.
Yes, and everything's processed. Even whole wheat flour, I really think, wheat has a lot of
Gluten.
problems, and starches, gluten. And a lot of people have sensitivity. They may not be celiac disease, but have sensitivity to wheat. It's very starchy. I think it's causing more diabetes, cardiovascular disease. So I really tell patients to back up on wheat, even whole wheat and whole wheat breads and things like that. And we can exist without it. So
Right.
really a low glycemic diet is what we promote at our office. We do a
Okay.
detox and cleansing program that's a 6-week detox and cleansing to introduce people to that type of eating where they're eating 80% raw. And
Okay.
so that is one thing that I think we can do on our own. with
Yeah.
that.
Now, when you talked about the
Change our diet.
change our diet, definitely. The wheat bread.
Yes.
Wheat has been pushed so much. It's like that's the healthy bread, and not to eat white bread. But wheat bread is that's what I've seen so much commercials, and just people that talk about nutrition. That'll talk about wheat and eating wheat. Oh, wheat bread is better. Make sure you get wheat bread and not white bread. But what I'm hearing from you today is that wheat bread can be just as bad.
Well, I mean, definitely white floured bread products and white flour is worse. And
Okay.
it's been chemicalized, it's been bleached, and we know some of the chemical it's been bleached with, we're finding out can be a trigger for causing diabetes. And so there's a direct connection. And I've read that some of those chemicals that they're giving, now they're giving it to animals in laboratory to cause diabetes when they want to test them. So when we're
Wow.
eating a lot of flour products, we're setting ourselves up for diabetes, heart disease, they come together, hypertension.
Yeah.
And so that's one thing. Now the whole grain, is in the whole wheat products and pasta, etc. But it's still processed, and a lot
Okay.
of wheat now in the United States is genetically modified, where they put the DNA of different organisms in the DNA of the wheat or corn. A lot of corn is
Really?
genetically modified, and corn is a starch, and so
Wow.
it does. Our body, it doesn't know what to do with it, and so it places it somewhere. So we're thinking this genetically modified foods may be increasing the risk for cancer, autoimmune problems
Yeah.
like rheumatoid arthritis, MS, lupus, Sjogren's disease, all these things we don't want. So the less we do the starchy foods, I think the better we do. Some of the
Wow.
gluten-free foods are still a problem because a lot of times when you take out the gluten, you put in other starches like potato starch, etc. And we mentioned potatoes is very starchy and raises the blood sugar. So just because it's gluten-free, that's still a processed food. So I try to get my patients off the packaged cereals and the breads and
Okay.
the crackers and the cookies. Even corn, popcorn, corn chips and things like that, because corn
Really?
is genetically modified unless it's organic, but it is a starchy food, and so it can raise the blood sugar, increase the risk for heart disease. So we have to eat it different ways. So what do you eat? You eat vegetables,
Exactly. That's my
beans,
next question. What do you
lentils.
eat?
You eat fresh foods, like our grandparents ate. You get it from the garden, we pick it, we bring it home and prepare it, as opposed to all this packaged canned stuff, boxed stuff.
Yeah.
Yes.
And
Get back to our roots.
I don't get back to our roots,
Yes.
which is a challenge because our palates have been conditioned to have flavor and good taste. What we see as good taste, because that's what we were accustomed to. So making that modification is where the challenge comes in, and finding foods that are good for us that are also good to us. If that makes any sense at all. And that's always been my challenge when I'm trying to find the right things to eat to keep my body mass down or keep my weight down. That's always been my challenge, trying to find things that I really like that are also good for me. Now, back to the breast cancer that we were talking about. What is a good age for a woman to be tested for breast cancer?
Well, I think we need to start earlier because there are women as early as their 20s that are being diagnosed with breast cancer, and occasionally in the teens. So we have to really be savvy about it by starting with being healthier, but we need to start screening earlier. So that's why I like the thermography. That's why if we notice we have lumpy, tender breasts, it's a sign of hormone imbalance, and you know, going to the doctor, a holistic doctor that we test for hormone imbalance with saliva tests where you average 4 different levels in a day, as
Okay.
opposed to a blood test where you just do 1 level, but hormone levels fluctuate, and so you want to do that. So I think that's something. Eating healthy, you know, and but as far as mammogram, you know,
Right.
go by, you know, you can go by your doctor's advice. Usually it's around 45, some say 50, but we know
To
women
get,
are diagnosed earlier,
yeah.
20s, 30s, 40s, with breast cancer. So listen to your doctor if they have a high sense of suspicion, you know,
Okay.
start screening earlier. But we can be proactive. So I think most women should take advantage of doing a thermography. You usually do 1. It takes about 10 minutes. There's no pressing. And you
Okay.
repeat it in 3 months. If there's no suspicious changes, every year. And I have women that are breast cancer survivors that are screening the opposite side, or even the side that's involved, whether they
Okay.
have an implant or not there, cosmetic changes, because it can still, since the heat sensor changes, want to make sure there's no cells in that chest wall. Because
Okay.
cells are not seen on, you know,
The
the
mammogram.
PET scan and CAT
Okay.
scan. So we want to get proactive. And there's some new tests that are developed that, you know, that can help screen for recurrences and even treatment earlier.
Okay.
You know, so I think we need to get proactive.
Wow.
Yes.
I think that organic stuff seems to be the ticket
Well,
to everything.
pesticides are estrogen stimulators, and so they stimulate hormonally sensitive tissue like breast, uterus, ovaries, and prostate. For African American men, prostate cancer is the number one, you know,
Yeah.
it has the highest rate in the world for African American
Wow.
men. So we want to decrease estrogen stimulators, those false estrogens, you know.
Okay.
Yeah, and so that's another reason we want to watch, you know, stay away from the pesticides. So growing our own, we can grow our own, or if we know somebody that grows without pesticides,
Mhm.
you know, or local co-ops, you know, but we need to
Wow.
get back to our roots again.
We need to get back to our roots again. Okay, we're going to be back to our roots again in just a moment with Let's Talk About It when I continue to talk to my wonderful guest. And I want to know from you how you were affected by the breast cancer. When I say how you were affected, I want to know the life change that took place for you after breast cancer. We'll be back in just a moment with more of Let's Talk About It. You guys want to stick around. All right, welcome back to this edition of Let's Talk About It, where our topic today is breast cancer. I wanted to add, we left off, and I was asking you about how breast cancer has affected your life. How has breast cancer affected your life?
Well, I would say that I learned that I was taking my health for granted. It's nothing like a little cancer to make you want to live. And so I was basically just kind of living a humdrum day-to-day life and not really trying to do my best every day. And then all of a sudden when your life comes into question whether or not you're going to live or die, that's all you want to do is live.
Right.
And so, you know, again, I took my health into my hands and decided I wasn't going to eat meat anymore, focus on vegetables and fruits, exercising, trying to get my BMI down, the body mass index down, so that I can be in better health. And
Right.
I care about that, and not because, you know, as a woman, I feel attractive as I am, but it has nothing to do with being healthy.
Mm-hmm.
So it really came to light for me that, you know, being attractive is way over here. It's just, it's not as
The big
important.
scheme of things.
Yeah, in the big scheme of things, that's not a big deal.
Right.
But what I need to focus on is being healthy and teaching my son how to be healthy and live a healthier lifestyle, because, you know, he watches me.
Right.
And learns from me, and you know, of course, I'm feeding him, and he's even now coming to a place where he wants to eat more vegetables and he wants juices, and I want a juice, can you do a smoothie for me? And so, you know, I'm affecting his life, you know, long term as well. So basically, it just taught me not to take advantage of my health and to take that seriously and take control of it.
Right.
Personally, and I do that every day. I do that every day.
Fantastic. So that's been the life change for you.
That has been the life change for me. Yeah.
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 I know you used to have long hair too.
I did. I
Yeah.
did.
So that was a big adjustment for you, wasn't it?
It was. I've had long hair all my life, and at some point going through the chemo, I was losing the hair, and I felt it to be more hurtful to watch it just fall slowly. So I took control once again and
Okay.
shaved my head, and fortunately I had a dear friend who shaved her head with me.
Yeah, and you know what? That's one of the things too. It's so important to have support when
Yes.
you're going through a challenge like that. So it's so good to hear that you had a good support system and a friend who actually
Absolutely.
did the same thing, shaved her head at the same time that you did.
Yes, and now I am growing my hair back from chemo, and I kind of like it. I kind of
beautiful.
like it.
Yeah, it works for
So,
you.
thank you. But, you know, again, it's not about the hair. During my process with breast cancer, I had the opportunity to reach out to several different organizations for support. The Rose was one that I spoke of earlier.
Okay.
Sisters Network, again, another one. And then Beauty Beyond Breast Cancer is another one, and they provide wigs for women who are going through. And I worked with the president. Her name is Vanita Graves, and let me give you their.
Yeah. Go ahead and give the website information
is
for them.
beautybeyondbc.org. And they're actually doing a wig drive right now through the month of October to collect wigs at various locations. If you go to the website, they'll have the locations posted there as to where you can drop a new wig for someone who's dealing with breast cancer.
That's fantastic, because that's what women need. I think it helps them a lot to have some other hair they can put on when they're going through that process.
Right.
To just feel better about themselves and feel good about themselves. Dr. Atkins, I wanted to ask you, is there any final thoughts that you'd like to say, or any more information that you'd like to give?
Yes, I just want the public to know we also need to be conscious, not just what we put in our body, but also what we put on our body. So as far as cosmetics, nail polish, on our hair, oils, lotions, etc., because 40% what we put on our skin is soaked into the bloodstream. So we really emphasize getting away from petroleum, mineral oil-based products. And so we look at our cosmetics, for example, lipstick. I wear lipstick, but I don't wear one with a mineral oil base or a petroleum base. You can find lipstick that's in a beeswax base or castor oil. So because those things can stimulate the estrogen receptors, the bad oils. You think something like baby oil, mineral oil is a mineral oil. So I tell people, if you can't eat it, don't put it on your skin. So coconut oil, olive oil, just get out of the kitchen. You can slather that on instead of lotion. Keep it simple. But even what we put on our hair, we have to learn to use more natural things.
Yeah.
And natural cosmetics, you can look at the health food store on the internet,
Right.
but there's better options, and there's chemicals in nail polish, so you want to find less toxic
Wow.
nail polish.
So it's just about everything you use is yeah.
Well, we can be beautiful, but there's some more natural options, so I just want us to search out those natural options.
All right.
Okay.
Well, speaking of cosmetics, there's a line I think out of Houston that's a natural cosmetic line called Lamique. And this is a plug for you, Kim Roxy, by the way, who actually is the creator of Lamique Cosmetics. We had her on the show, and her line is really doing well. So that's one that you guys can consider when you're thinking about it. And my producer here on the show actually wears it as well, very proudly. Now, for more information on Dr. Atkins, is there a website that you can be reached at?
Yes, our office is called Center for Wellness and Healing, so the website is at centerforwellnessandhealing.com. All the words are spelled out, even the and. Again, centerforwellnessandhealing.com, and our office number is 713-520-9611 in Houston, Texas.
All right.
Okay, thank
So for any more information, you guys can certainly contact Dr. Atkins at the information that she just left. And also, we heard also from Lady on the wigs that you guys can get, as well as the organization called the Rose and
Rose and Sisters Network.
and Sisters Network. All right. Thanks so much for joining me on this edition of Let's Talk About It. We look forward to seeing you next time. And for more information on this show, you can reach us at Let's Talk About It 12tv@gmail.com. That's Let's Talk About It 12tv@gmail.com. Until next time.